Hello everyone, welcome to my channel. Today the video is about schizophrenia. First, the essentials of diagnosis and typical features of schizophrenia. These include number 1, delusional thoughts, which include false belief or judgment about the external reality. Number 2, disorganized speech, which is rambling or illogical speech pattern. Number 3, disorganized or bizarre behavior. Number 4, hallucination, which may be auditory, visual, tactile, or olfactory. And number 5, negative symptoms, that is flat affect, alogia, that is poverty of speech, and avolition, that is an inability to initiate and persist in goal-directed activities. Now, the incidence of schizophrenia is about 1 per 10,000 per year. The onset of schizophrenia is typically between the mid to late teens and early 30s, with the onset before puberty being relatively rare. Symptoms usually begin after puberty, although a full psychotic break may not occur until the young adult years. Childhood onset of the psychotic symptoms due to schizophrenia is uncommon and usually indicate a more severe form of the spectrum of the schizophrenic disorders. Now, schizophrenia affects only 1 or 2 children in every 10,000 of the population younger than age 15 years, and boys outnumber girls by approximately 2:1. Now, childhood schizophrenia appears to be genetically related to the adult type of schizophrenia. And schizophrenia is a biologically based disease with a strong genetic component. Other psychotic disorders that may be encountered in childhood or adolescence include schizoaffective disorder and psychosis not otherwise specified. Psychosis not otherwise specified may be used as a differential diagnosis when psychotic symptoms are present, but the cluster of symptoms is not consistent with a schizophrenia diagnosis. Now, the clinical findings. Children and adolescents display many of the symptoms of adult schizophrenia. Hallucinations or delusions, bizarre and morbid thought content, and rambling and illogical speech are typical. Affected individuals tend to withdraw into an internal world of fantasy and may then equate fantasy with the external reality. They generally have difficulty with the schoolwork and with peer relationships. Adolescents may have a prodromal period of depression prior to the onset of psychotic symptoms. The majority of the patients with childhood onset schizophrenia have had non-specific psychiatric symptoms or symptoms of delayed development for months or years prior to the onset of their overtly psychotic symptoms. Now, the differential diagnosis. Obtaining the family history of mental illness is critical when assessing children and adolescents with psychotic symptoms. Psychological testing is often helpful in identifying or ruling out psychotic thought processes. Psychotic symptoms in children younger than age 8 years must be differentiated from manifestation of normal vivid fantasy life or abuse-related symptoms. Children with psychotic disorders often have learning disabilities and attention difficulties in addition to disorganized thoughts, delusion, and hallucinations. In psychotic adolescent, mania is differentiated by high levels of energy, excitement, and irritability. Any child or adolescent exhibiting new psychotic symptoms require a medical evaluation that include physical and neurological examination, including consideration of magnetic resonance imaging and electroencephalogram, drug screening, and metabolic screening for endocrinopathies, Wilson disease, and delirium. Now, the treatment of childhood and adolescent schizophrenia focuses on 4 main areas. Number 1, decreasing active psychotic symptoms. Number 2, supporting development of social and cognitive skills. Number 3, reducing the risk of relapse of psychotic symptoms. And the last, providing support and education to the parents and the family members. Now, antipsychotic medication, for example, risperidone, olanzapine, and haloperidol are the primary psychopharmacologic intervention. In addition, a supportive, reality-oriented focus in relationships can help to reduce hallucination, delusion, and frightening thoughts. A special school or day treatment environment may be necessary depending on the child's or adolescent ability to tolerate the school day and classroom activities. Support for the family emphasizes the importance of clear, focused communication and an emotionally calm climate in preventing the recurrences of overtly psychotic symptoms. Now, the prognosis. Schizophrenia is a chronic disorder with exacerbation and remission of the psychotic symptoms. It is generally believed that earlier onset, that is prior to age 13 years, and poor premorbid functioning, that is oddness or eccentricity, generally predict a poor outcome. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health related videos.